Did you know that the cost of bladder cancer care is more than $5 billion a year? With a very high rate of recurrence, this disease needs to be followed closely. Today, we're learning more, much more, the signs, symptoms, diagnosis, and treatment management. And more importantly, the role technology is playing in bladder cancer detection. Joining me virtually are urologist Dr. Neil Shore from Atlantic Urology Clinics in Myrtle Beach, South Carolina, and Cameron Todd, who has bladder cancer. Welcome to both of you.
Thank you.
Good morning.
Good morning. Cameron, let me start with you. How did you first know you had an issue?
In August of 2017, I was on a business trip in Northern California and went to bed. Woke up in the middle of the night to go to the bathroom and noticed that the urine was not urine, but it was blood. It was a heavy flow of blood. It happened a couple of times after that through the evening. Got up the next morning, called our urologist, and set up an appointment for the following week to discuss it with him.
Doctor, you're not Cameron's physician, but you deal obviously with bladder cancer on a regular basis. Can you give us just the basics of this disease, please?
I've been dealing with patients, I'm sure very similar to Cameron, for close to 30 years now. Bladder cancer doesn't always get the same attention as other cancers that have a higher prevalence rate, for example, breast cancer and prostate cancer. But I mean, you know, we have over 80,000 men and women in the United States who get bladder cancer. So it's not insignificant. The bottom line is that when you see blood in the urine, or if it's detected under the microscope, this is important. It could be a sign of bladder cancer.
So, doctor, can we talk a little bit about risk factors and those who are at risk? Obviously, someone who has a predisposition, if you will.
It can be detected primarily because, or looked at patients who have at high risk. The big one is smoking. Second most commonly associated malignancy after lung cancer. Many folks really just don't know that. Exposure to certain petrochemicals, asbestos, chronic recurrent infections, chronic inflammation can also be an elevated risk for developing bladder cancer.
And doctor, proper detection is key, obviously, with any kind of cancer. But bladder cancer can be unseeable. So how do we treat it?
It comes down to looking into the bladder and taking a look and seeing, is there an abnormal looking lesion in the bladder? But the key is really detecting it visibly with what's called a cystoscopy. The traditional way we've done for many, many years is white light cystoscopy, but we have newer, up-to-date diagnostic modalities such as blue light cystoscopy, where it uses two different light sources, both white and blue light. Cysview, which is a imaging agent, is placed in the bladder through a simple catheter, and it allows us to see the tumors that glow in the blue light. It also allows us to see tumors that we might have missed when we were doing our biopsy. And this Cysview technology can be performed in an office setting, and it can also be performed in an ambulatory surgery setting or even in hospital setting.
That procedure is an hour and a half. Simple, nothing to get excited about, no pain, no strain, a wonderful experience. Once Cysview is inserted in the bladder, the cancer will glow bright pink in blue light. They saw cancer, and they did something about it right then and there. When they're finished, they basically say, you're cancer-free today.
Doctor, I'd like to end with you. Any final thoughts for our viewers?
You want to be aware of this breakthrough technology called Cysview, and I would certainly inquire with my urologist to make sure that they have that technology available when they do their diagnosis as well as their resection of your bladder cancer.
Doctor, thank you so much for your time and all the valuable information. And Cameron, to you, good luck, and thank you for sharing your story.
Bye-bye.
Thank you very much.
And for more information, you can go to cysview.com, or you can always just check out our website, thebalancingact.com. We'll be right back.
Cysview, hexaminolevulinate, is an optical imaging agent used to detect non-muscle invasive bladder cancer in patients suspected or known to have lesions on the basis of a prior cystoscopy or in patients undergoing surveillance cystoscopy for bladder cancer. Cysview is not a replacement for random bladder biopsies or other procedures used in the detection of bladder cancer. Anaphylactoid shock, hypersensitivity reactions, bladder pain, bladder inflammation, cystitis, and abnormal urine tests have been reported after administration of Cysview. The most common adverse reactions seen in clinical trials were bladder spasm, trouble urinating, discomfort when urinating, frequent urination, blood in the urine, and bladder pain. Cysview should not be used in patients with large amounts of blood in their urine, any known allergy to Cysview, or any derivative of aminolevulinate acid or porphyria, a condition that means you already have high levels of porphyrins in your body. No specific drug interaction studies have been performed.